Healthcare organizations are embracing portals a variety of ways. First and foremost, portals are very useful for bringing information together for people in a roles-based, secure, and flexible manner. And so hospitals, health plans, and governments are using portals to extract information out of those systems, whether they're clinical systems or administrative systems, and present that information in a way that's useful to the person who has to use it. So in a clinical case, providing a census list, providing an extract from labs, pharma, or a scheduling system to get an understanding of what is happening to that individual. On the patient side, we've done a considerable amount of work helping institutions provide relevant information to them. For instance, the ability to schedule a procedure online, to make an appointment with a clinic to get a wellness follow-up, to be able to change that if my schedule changes directly. We've had significant uptake by patients who want to access to their clinical record so that they can get their lab results online. So those are some examples of how healthcare institutions have used portals. Portals can play a unique role, and hospitals, health plans, and governments are embracing them because they allow for a flexible and reusable delivery of information. So, for example, most hospitals have common back-end systems, a patient administration and accounting system, common electronic medical record, physician order entry. Portals are very useful in attaching to those systems, finding that particular patient record, and delivering that to a clinician. The value that hospital systems are getting out of portals is varied and well documented. At Catholic Healthcare West, for example, in Arizona in the United States, clinicians are reporting 2 to 3 hours of time savings per clinician per shift. And why is that? Portals help them handle the log-on process, the finding of information, the pulling it together in a view around the patient. IBM has uniquely helped them by linking together the portal technology with the context technology that is extracting that information out of those silos on behalf of those clinicians. In that workflow, we're saving many steps. It's not uncommon to report reducing what would take 27 individual operations down to 8 or 10 on behalf of the clinician. So portals are a significant time saver for clinicians. It also helps them in their role in workflow. We know that surgeons work very different from referring physicians or hospitalists. The surgeons want their schedule, they want the key labs, they want to know what they have to do next. General practitioners or referring physicians are looking for a more comprehensive set of information around their patient. They're looking for labs, medications, previous encounters, to understand what's happening for that particular patient. On the patient side, again, there's been considerable value both for institutions and for patients. We've worked extensively with Duke University, and Duke reports that patients who use the portal are 5 to 7% more likely to show up for their appointment than an individual who doesn't. So they get quite an improvement of resource utilization and physicians' time utilization. They don't have gaps in their schedule as was previously they were previously subjected to. On the patient side, patients report that approximately 50% of the time they're not able to make the appointment at the time they originally schedule it. So scheduling portals help streamline that process and save customer service time in the rescheduling process and improve the satisfaction of the patient if they can go online and move an appointment to where it's more where they're able to do it or to cancel it if necessary. So savings both on the clinical side and on the patient side are good examples. George?
I think Tony brings up an excellent point that we went by, one of the important aspects of clinical work is that there's a specific workflow. And what happens in clinical systems is that the workflow process is locked up within these applications. So the additional value of portals is that you can create this Uber process capability now and orchestrate workflow across multiple applications, which normally could not have been done within a single siloed application. Very valuable. And this is really playing towards the solution of the fragmented approach that we have when we have a lot of integration points and touch points between clinicians. This allows clinicians to have a better workflow and be more productive.
Hospitals have begun to adopt collaboration across their enterprise. And the reasons for that are many. Care has become much more complex. It's much more of a team sport where a variety of physicians need to come together on a complex case. And so physicians are using collaboration to pass records from shift to shift in their handoffs and notes. They're using collaboration person to person to understand who's available for consultation. And they're using things like wikis to pass knowledge on to the next crew or to residents and interns. That knowledge capture, that real-time collaboration are increasingly a key part of hospital operation, as is finding knowledge. Understanding who the expert is in a particular procedure, extracting that knowledge that's sometimes locked up in people is an important part of collaboration.